Hello from UNFPA Asia and the Pacific, and welcome to our ongoing series, ICPD 25, What's Changed? We're documenting how much progress we've made in the last 25 years in our region since the revolutionary ICPD Program of Action came into being, and how far we still have to go as we accelerate ICPD to achieve the rights and choices for all. Today's panel focuses on community mobilization from the perspective of people actually working in the community. We are talking about sexual reproductive health and rights, including HIV prevention, treatment, and care, all of which ultimately are filtered through the wider lens of human rights for all, regardless of sexual orientation or gender identity. I should also note that we are holding this panel in June 2019, which is Pride Month, and we're celebrating here in Asia and the Pacific and globally. We have 5 wonderful panelists with us here today, each of whom has been immersed in community mobilization and advocacy, and all of them are passionate about the fight for rights and choices and genuine equality. So let me start by introducing the panel. First, I'd like to introduce Ikka. Ikka is 25 years old, and she is from Indonesia. She's currently working at Youth Lead as an advocacy and capacity development officer, and she has experience working with key population networks at both the regional and national level. At the national level, she's worked with a community of sex workers and other young key populations. Her passion is for gender equality, minority rights, and adolescent well-being. Welcome, Ikka. Our next panelist is Joe Wong. Welcome, Joe. Joe is a transmasculine advocate born in Singapore. He is the executive director of Asia Pacific Transgender Network, and he's also the driving force behind the Asia and Pacific Trans Health Blueprint, a key document outlining the challenges, gaps, and interventions for transgender people in the region. Joe is also published in the International AIDS Society Journal, as well as contributing the crucial but often ignored transgender perspective for publications like The Lancet. Welcome, Joe. Our next panelist, Inad. He has been with APCOM since 2013 and has a very diverse role there, overseeing and working on projects in research, strategic information, demand generation, behavior change communication, and as well as focusing on human rights. He is originally from the Philippines. Welcome. Our next panelist is Ha. Ha is a third-year student in Vietnam, and she is a co-member of the Vietnam Network of Young Key Affected Populations. She is a founder of the 402 group, and she counsels and supports members on HIV risk and drug use. Our next panelist and our final panelist is Ayel. Ayel is a young gay theologian and sexual and reproductive health and rights social worker from Indonesia. He's the chair of the board of Intamudi, which is the Indonesia Young Key Population Network. He also works at the Indonesia Interfaith Forum on Sexuality and has been working with the LGBTQI community for many years as a youth advocate and community mobilizer. I'd like to thank all of the panelists for joining me today. And my name is Kamma Blair. I work at the Asia Pacific Regional Office here in Bangkok, Thailand. So as a means of introducing yourselves, can you please tell me why, as an individual, you dedicated your work's life, your life passion, to sexual reproductive health and HIV prevention? Ikka, let's start with you.
Yeah, as you know, as a young sex worker living with HIV, I never thought will dedicate my life in HIV work as well. When I found my status on that time, I just wanted to learn and want to meet with my the other peers and the other friends who living with HIV. But then, as time goes, I met with so many young sex workers who never want to live with HIV as well. Then I said that make me want to dedicate my life to do HIV work.
Great. And what about you, Joe?
Well, I think it's relatively safe to say that we wear many protective layers to function daily in life. And one of the privileges I have had is to be able to pass as a male easily. And that kind of made me realize my transitioning journey as a trans masculine person kind of made me realize that there are things that the community doesn't have, and now I have the privilege of having. For example, being able to live as a man or to appear as a man on my legal gender recognition documents. And so starting out there really isn't anything at the beginning, and now that I have such privilege and space, I kind of want to continue doing something for others, and I've had role models when I was starting out to kind of inspire me to do this work.
Great, great. Nad, what about you?
I am a gay man who grew up in the Philippines in a family with really strict religious background. And like that reason alone is very difficult to look for inspiration of how it is to live as a gay person growing up. And I found that inspiration within myself, and now I decided maybe I should also share that inspiration to others who are looking for one or who are looking for a role model. That's why I decided to work on this advocacy.
Thank you. Ha, what about you? How did you get involved and become passionate about this work?
I'm a member of the drug user community, and fortunately I'm a K member of VICAP. Then I have been working more in the field of HIV. On the day that my friend who was infected with HIV shared to me about his extreme desperation, so that I really want to help him. It make me feel interested in, and I want to study more about that.
Oh, thank you. Thank you so much.
Yeah, I remember in 2012, I joined one of the NGO youth-led LGBTIQ community that work for sexuality and interreligious issues. And after that, at the time, after 4 years, I met with someone that come from the HIV background. He is one of the leader of small gay community in Jakarta, and he taught me a lot about the HIV issues, AIDS, STIs, and so on. And at the time, I realized that I am at the risky behavior, and also I should do something about myself and also about my community and gay young person also. So that at the time, I decided to join that community, and until now, I am still in this movement. Yeah.
Oh. Well, thank you for sharing that with me. I feel for myself, I've been working in sexual reproductive health and rights for almost 20 years now. And if I can share with you very quickly my story, how I got involved in this movement, because the one thing I truly love about this work is the sense of community that we're able to build and moving together. Even though there's communities within communities within communities in the work that we do, we're all moving forward and looking forward to, for equality and for equal rights. And so when really the moment that spurred me was about 20 years ago. As part of my work, I went to an HIV orphanage as part of my role. And there was a little boy, I'll call him Henry. And, we were just playing, and there was a marker, and he had painted my fingernails with the marker black, because it was the color of the marker. And, I went home after that, I went to wash my hands, and I could see that, I couldn't get this marker off. And not that long after, one of the caretakers from the orphanage for the children affected by HIV had called and told me that little Henry had passed away. And I still had those marks on my finger, and I had to watch them grow out. And even last night, when I was preparing for this, I thought about him. So I think about the world that Henry was born into. And that was at the time when there wasn't easy access to antiretroviral therapy. Nevirapine, the drug that prevents mother-to-child transmission, wasn't that available. So the world he was born into isn't the world we live in now. And he could have been on this panel had he been born now. So it made me think about, well, what has happened in the last 25 years? Even for me personally, I know some of our panelists aren't 25. So we want to get this perspective of what do you see has changed over the past 25 years? What do you think? What about you, Ikka?
I think the most change in this HIV work is now we have like access to get the medication, and also the prevention is like available for all the people. Yeah. And also the engagement of community as well.
Right. What about you, Joe?
I think so much have changed. 25 years ago, I was just 10-year-old, right? And I mean, there is so much realization of rights right now within the community, like what they can stand out for. It's no longer like, I am different and nothing can be done. The community really has strengthened itself throughout these years with support from one another within community systems and like community within community. That's what you were saying. And there's a lot of recognition right now of these issues. There are so much more data available right now. You're right, like we're living in a world and there are others who are not living in our world. And now they have the chance to see what the other world and the perfect or the ideal world looks like for them.
That's lovely, thank you. What about you, Inad?
I have this movie which I watched like when I was on a plane coming back to Bangkok. It's called On the Basis of Sex.
Okay.
And there was one line which I really liked the most, which says, we are working now not because of the climate of the day, but because of the weather of the era. It's not nice, right? Basically, the generation at this point has changed over the past 25 years. And I can see a lot of young people who are molding and shaping of what the next generation would come, which has more courage and more value in terms of participation and voice, and also being able to represent themselves in important discussions.
Right. Yeah, that's a really good point. And what about you, Ha?
You know, Vietnam is a developing country that make me young people easier to approach the dark. Member of your white put is increased, so I think that you should have more education program about HIV for them. Vietnam doesn't have specifically harm reduction surveys, just only general surveys.
And Missael, what about you?
Yeah, if you ask me, my first answer is I'm not witch or wizard because, you know, I'm still 25, so I cannot review the whole 25 years, of course, yeah. But at least as far I know and within my experience, the young people now more engaged with the HIV movement, HIV prevention movement. That happens, I want to raise this issue, not because the work of one person or someone, but it's because of all of our work and all of our effort. Young people cannot engage in this movement if the adult didn't give the good technical assistance for us. And also young people cannot engage with this movement if the environment didn't made to be youth friendly with the young people. So also, if we cannot access the resources, for example, like the funding, so it's all because of us. It's all about us. We cannot see the young people's stance by themselves only, but this young people's engagement is work of all the parties.
Right.
Yeah.
So I think you raise an interesting point about creating space.
Yes.
And then how communities can operate within that space or mobilize within that space. So maybe Joe, can you tell us just a little bit about how you feel your community has mobilized, both peers, funding, and how have you been able to do that to strengthen your advocacy efforts?
I think it's there's definitely the strength in number is definitely a thing here. Like we're looking at individuals coming together, forming large communities, and lobbying and advocating for a change. And it really started with like having the common ideas around what it should look like and what people want. The resilience is something that the most marginalized groups will often have, because that's the only thing they have to live and get support by. And so it's really coming together and listening to one another and knowing that they have common grounds. Funding is not always the top of the priority for the community. It's about how can we realize our rights and how do we then strategize collectively to do that together. And as now the movement gets bigger, it gets more fragmentized at the same time. And it's about how do we maintain the momentum that started 25 years ago.
Right. Inad, do you have any reflections on this?
I do a lot. Where do I begin? So there is this dangerous assumption about community that they don't have the inherent capacity to organize by themselves. And that includes the UN system, particularly at the country level. And I just had an argument with a funding agency because they would not allow a particular activity to be implemented at the country level because the community literacy level is very low. And then I asked, what gave you that assumption that the literacy level is very low? And this assumption from the stakeholders who are, who are supposed to be enabling these communities, having that assumption would kind of like push them back on what they're able to provide or support the community. As what Joe has mentioned, that fact itself that the communities are forming themselves together or associating themselves is in fact a sign of a capacity. And that capacity is ingrained with a goal and objectives of what they want to, where they want to go and what they want to achieve.
Ikka, do you have any thoughts on community mobilization and how you've been able to mobilize your peers and so forth?
Yeah, so currently I'm working with Youth Lead, Young Key Population Organization based in here in Bangkok. It started just in 2010. We just start from a small project, financially funded by UNFPA on that time, and our focal point play like an important role to mobilize the peers. So they bring in the other people to join, and they bring in their issue and their idea to how we are advocate their rights in the country level and also the regional level. And 2012, we became an independent organization, and we have established our first strategic plan and also governance handbook. Then on 2014, we became we registered as an organization here in Thailand. Yeah, as a part of our focal point, so we start to get more funding and more support from the other stakeholder, and it became now we can change and we became a pretty big organization.
So that step-by-step process of building and using the community capacity and passion for the work can help move it forward. What about you, Ha? What do you think? How has your community been able to mobilize itself and build advocacy efforts, financing, and so forth?
We bring a part of profits and reinvest to organization activities, expand the partnership into the education sector, try to develop the new partnership on the field on HIV, LGBT. That's all.
That's a lot. Ayel.
So in Indonesia, with my organization Inti Muda, Indonesia Young Key Population Network, luckily we have a good quality of the UN in Indonesia. We can mention UNICEF, UNH, UNFPA, some they support us. But we believe after this, they will fully support us working with YKP. So with their support, I can mention, for the example, one program like linkages of quality care of young key population, Lollipop, with this collaboration with Ministry of Health and UNICEF, and of course my organization, and also formally National AIDS Commission. We work together, and the key of a successful story from that program is to give the young peoples more empower, and we got a lot of like capacity strengthening so that we can mobilize more of young people in 6 districts: Jakarta, Bali, Medan, Makassar, and so on. And from that things, we believe that capacity strengthening for young people, that's the really first important things that should be given to young people, so that after that, they can raise their issues, they can fight for their rights, then they can do the advocacy by themselves, and also working together with another networks. Yeah.
Mm-hmm. So you're all part of a network, and you all have peers, and we are all complex people. I think that's the one thing. We're not just one. We're not just one thing. We're many different people all in one. So with that in mind, knowing how complicated we are as human beings, and also knowing that you are representing your community, do you feel that your communities are being listened to? I mean, there may be many communities that you're part of. Are you being listened to? And if not, who's being excluded? What do you think? Ayel?
Yeah, like I said before we got a lot of support from many stakeholders and UN agency. We think that we have a lack of knowledge. We don't know how to raise our issue, how to speak up in front of the government. But after that, after times goes by, we learn by fault, we learn by doing, we learn from others' networks, stronger network in Indonesia. Finally, at least we are have a space to talk about our rights. Even it's not enough for us, so that's why it's a continuing process for us, so that young people fully accepted by this movement, so that we are listened more be listened by this environment. Yeah.
So Inad, maybe you can just elaborate a bit on, who do you think is being excluded, and what do we need to do to actually make sure everyone is listened to?
By whom?
That's a great question. By whom? By government, by UN, by other members of the community? It's so complicated, isn't it?
Yes.
So
it is very complicated, and because of its complexity, there are different levels of challenges that the community face. So I guess the first question that we should answer is, who is the community? And the community that we serve are the members of the population whom we reach for the services that should be available and freely accessible. So in the case of HIV, in case of our network, HIV and AIDS, we are reaching out to the gay men and MSM community who are most at risk of acquiring HIV. So at the country level, and they're actually being called as key populations in different terminologies because of some legal barriers that are existing in their access to services. When we talk about listen to, I guess I have to go back to that assumption again, where the communities are being listened to. Yes, that's the question. That's the answer to the question. But being listened to as beneficiaries of the services or interventions that are being provided, instead of being listened to as equally able partners, as implementers of the project. And that is really manifest at the country level, especially those countries where the key populations are still criminalized or being discriminated upon. Who are excluded? I guess there are different community systems or mechanisms within the community which allows everyone to actually provide input and to provide feedback on a particular issue. However, the systems that are in place will then bar some of this inputs or feedback to be inputted in that whatever discussions that are having. It is inadvertent or unintentional, but then again, because of that systems in place, some communities or some parts of the communities are not being heard of.
Okay, thank you. Joe, do you have anything to reflect on?
Lots of
what's being
reflection,
said?
really. I mean, globally, politically, and legally, the situation is changing so rapidly. I think one of the things is we need to learn and unlearn, listen and unlisten. We need to continuously, know that the situation for people are changing so rapidly. For the trans community, for example, their needs have shifted. So what we may have heard or been listened, like what people have listened to our needs were in the past 20 years, for example, would not be valid anymore. And it's a lot of resistance from people who used to listen from us or attempt to listen from us that this is the reality now, I'm sorry, but your knowledge of the matter is outdated. So
I even feel that from myself.
like we need to be able to unlearn things. And I say that even for myself, like my understanding of the transgender landscape from before and now has shifted so much, and there's so much learning here to be done.
Yeah, we're not stagnant.
We're not stagnant,
Yeah.
and then we don't, like the thing is, we have representation of different community people, young people, key populations as people call it, in spaces, but are they really being put in place because they need to be there, or like, was it to address the needs of the community that they are placed there to be listened to really, and have a chance to even shape that discussion and dialogue?
Right. Yeah. Thank you. So for you, how do we ensure that everyone is listened to? So for members from your community, how do we ensure that they are heard, that they are listened to?
As you know, I'm a member of a community, so easier to me to approach the young put. Moreover, our members are allocated to specific position for all of the communities. We also collect and respond member opinion, especially the year action plan.
Thank you. And what about you, Ikka?
Yeah,
What do you think?
Are we being listened well? My question is, are we can speak well? Like, for example, when the UN or government have a consultation, they often do it in the English language. As we know, English language is not our mother language in most of country. Yet the hosting is not aware with that. So, yeah, being listening, or can we speak on that time?
That's a really valid point. It's hearing and listening and sharing and engaging in the it's having a conversation, isn't it really? And making sure that you're hearing and listening. Yeah. Great point. So I have one final question for you. Can you tell me, just very quickly, if we are to end HIV by 2030, what should we do? Ikka?
Yeah. What should we do when we want to end the HIV transmission by 2030? Please focus on what we as a community need, not what you need. So please be reminded, when you targeted us as be a target, just remind we are human. We have a human right, and also we have human right to be fulfilled and also respect. So yeah, just aware of that.
That's lovely. Inat, what about you?
Can I ask someone to answer first?
What do we need to do to end HIV by 2030?
Oh.
So many things.
Can we end HIV by 2030? Well, that's still the question, right? If we're able to end HIV by 2030. Maybe maintaining or reaching epidemic control, yes, but not the HIV transmission. And there are a lot, to that question, I can write an essay, but for now, I guess we have to focus on who leads the interventions, who should be at the center of the response. There was a question that was addressed to me before, like how can the community support the implementation of the HIV programs? And then I replied, why will the community support? The community should lead the interventions. The stakeholders should support the community in leading these interventions.
Right. What about you, Ha? What do you think?
Currently, policies are not active for YKP's engagement. So we need your support to connect with more organizations to help us handling with us to speak out to government and big organization.
Ayel, anything to add?
I wrote two things that I want to deliver. The first one is listen to the young peoples, because you know epidemics are increasing in this community, and also if we listen, so they should also include in every intervention, of course. And the second is erase all the legal barrier that block young people to access the services, you know, such as like people under 18 who cannot access the services, HIV testing, because of they should include their parents. If it never happens, because we never say that, Mom, Dad, I am young people, please, I'm gay, so please help me, I want to go to test HIV testing. We will be killed, you know. So please erase all the legal barriers so that we can, or everyone can access the services and also the information.
That's great and so important, so important. And Joe, any comments?
I think we can aspire to be do many things to try to end it, and the key thing really is to align our core values and our principles here on how are we going to go about doing this to end HIV and AIDS. So what I would say is power sharing. Like, we need to find a balance between knowledge and skills. You may have the knowledge, I may have the skills. You may have the experience working within a sector. I have the lived experience as the community person. You have the power in your position. So redistribute spaces, open up dialogues, have conversations, real conversations. I think like by having real involvement of like people who really want to progress this work, which I think we are all here to progress the work, is just realigning ourselves to find a common way to do that. And that can begin by distributing the power. And that's, again, important because like we're not going to be here doing this work forever. And if we don't redistribute this power, by the time we get burnt out, we leave this movement, what's going to happen after that if we're not acknowledging the work of our seniors, the people who has inspired us, the older people who were there before us, who have changed the world in which we live in right now, and then grooming the young people, there's no way to get it done otherwise.
That's a really great point and a really wonderful way to end our panel today. And so, you know, for me, the message that I'm hearing, and please correct me, it's really about having community at the helm, being the leaders, and it's not just receiving of a service or of a program, but actually leading the implementation and the design and being part of that process. And I like your point that you said about, yes, you know, we need to be heard, you know, but we also need to speak. And so how do we create an environment where everyone is able to do that? And that's one of the challenges I think that we have going forward. We've seen a lot of shift in some of the data in terms of HIV transmission within this region, and we really need to regroup in a way and refocus some of our efforts and put community at the front and center. You know, I'm part of the older generation, the you know, ICPD 25. I remember ICPD in 1994. You know, sort of during the first wave of the HIV epidemic. So, you know, now it's a different time. So how do we come together to solve this together and work together to do that? It's a challenge, and I'm so grateful that you were here today to share with us your experience and your knowledge and your opinion. So thank you again, and let's do it together. Thank you.